Hey everyone, this is Mike. So let's talk today about how would uh, a follower of Alfred Adler, known as individual psychotherapy or Adlerian psychotherapy, treat someone with ADHD. Now we talked about Freud and we talked about Jung. How about the Adlerian approach? So let's talk about and speculate on that. Again, using Gemini AI for some speculative information. Okay. So, an Adlerian analyst grounded in Alfred Adler's individual psychology would view ADHD symptoms through a lens of social embeddedness, striving for significance, and the individual's unique lifestyle or pattern of interacting with the world. Rather than seeing ADHD as purely a neurological deficit, they would consider how the symptoms are integrated into the child or adult's overall psychological functioning and their pursuit of belonging and competence. Here's how an Adlerian analyst might speculate about that and treat ADHD. One, focus on inferiority feelings and striving for significance. So, core motivation. Adler believed that all individuals are born with feelings of inferiority, a natural sense of smallness and helplessness, and a fundamental drive to overcome these feelings by striving for superiority or significance. ADHD and discouragement. For someone with ADHD, the constant challenges with attention, organization, impulsivity, and follow through can lead to significant feelings of discouragement and inferiority. They may experience repeated failures in school, social situations, or tasks, leading to a belief that they are not good enough or incapable. Maladaptive striving. In an attempt to cope with these inferiority feelings, individuals with ADHD might develop maladaptive strategies to gain significance. For example, attention seeking. Hyperactivity or impulsivity could be seen as an unconscious attempt to gain attention, even if it's negative attention, as any attention is better than feeling ignored or insignificant. Procrastination avoidance. If they believe they will fail, they might avoid tasks altogether to protect their self-esteem, leading to further problems. And defiance rebellion. If they feel controlled or constantly criticized, they might act out as a way to assert their perceived power or autonomy. Two, understanding the lifestyle and private logic. Unique pattern. An Adlerian analyst would explore the individual's lifestyle, which is their unique, consistent pattern of thinking, feeling, and behaving developed in early childhood. This lifestyle incorporates their basic convictions about themselves, others, and life, and how they navigate their world. Mistaken beliefs. The analyst would look for mistaken beliefs or private logic that the individual with ADHD might have developed based on their experiences. For example, I'm stupid or incapable because I can't focus. People don't understand me, so I'll just do things my own way. If I don't get things done perfectly, it's not worth trying. Family constellation and early recollections. The analyst would also investigate the family constellation, birth order, family dynamics, and early childhood recollections to understand how the individual's unique style of interacting with the world and their sense of belonging were formed. This would provide clues as to the purpose behind their ADHD-related behaviors. Three, cultivating social interest and belonging. So social interest. Adler believed that mental health is strongly tied to social interest, the feeling of belonging, contribution, and cooperation with others for the common good. Individuals with ADHD might struggle with social interest due to their symptoms impacting relationships, for example, interrupting, difficulty listening, missing social cues, or due to feelings of being different or misunderstood. Therapeutic goal. A key goal would be to help the individual develop a stronger sense of social interest, moving from self-centered or discouraged behaviors to more cooperative and contributing ones. 4, therapeutic techniques and interventions. Building a collaborative relationship or engagement. The therapist would establish a warm, empathetic, and encouraging relationship with the client, emphasizing collaboration and mutual respect. This is crucial for someone who may have experienced a lot of criticism or discouragement. Assessment. This involves gathering information about the client's lifestyle, family constellation, early recollections, and current challenges. For ADHD, this would include understanding how symptoms manifest and impact various life domains such as school, work, and relationships. Encouragement. This is a cornerstone of Adlerian therapy. The therapist would focus on the individual's strengths and efforts, no matter how small, to combat feelings of discouragement and build self-confidence. This would involve acknowledging the effort behind even seemingly failed attempts. And reorientation and re-education. Challenging mistaken beliefs. The therapist would gently challenge the client's mistaken beliefs about themselves and their ADHD, helping them to see their strengths and potential. Insight into purpose, helping the clients understand the purpose of their behaviors. For example, when you interrupt, is it to make sure your idea is heard before you forget it or to gain attention, rather than just labeling them as bad? Acting as if. Encouraging your client to act as if they are already capable and confident in areas where they struggle. For example, what would a person who was organized do in this situation? Task setting and graduated steps, breaking down overwhelming tasks into smaller, manageable steps to build a sense of purpose and accomplishment and combat procrastination. Logical consequences. For children with ADHD, parents might be educated on using logical consequences rather than punishment to help the child learn from their actions and understand the natural outcomes of their choices. Catching oneself. Teaching clients to become aware of their impulsive urges and unhelpful thoughts before they act on them, giving them a chance to choose a different response. Developing responsibility, fostering a sense of personal responsibility for their choices and actions rather than blaming their ADHD or external factors. Focus on strength, highlighting the positive aspects often associated with ADHD, such as creativity, high energy, divergent thinking, and enthusiasm, and helping the individual leverage those strengths. And parent education. For children, Adlerian therapy often involves significant parent education, helping parents understand their child's private logic and how to foster cooperation, encouragement, and a sense of responsibility in the home. Some limitations. While Adlerian therapy can be incredibly helpful for building self-esteem, fostering social skills, and addressing the emotional and behavioral consequences of ADHD, it does not directly address the neurobiological aspects of the disorder. It is often most effective as a complementary therapy, particularly for understanding the psychological meaning of impact of ADHD on an individual's life, and helping them to develop more adaptive coping strategies. It would typically be used in conjunction with other evidence-based interventions like medication or behavioral therapy. I hope you found this helpful, and I will see you next time.